Welcome to our channel. Before going to next, I requested to our all viewers, if you like my efforts and videos, please subscribe my channel. Here I upload regularly home remedies, question about health and fitness, pregnancy, symptoms and many other queries about health. So let's start. Undeniably, pregnancy is one of the most beautiful and exciting phases in any woman's life. As someone said, a grand adventure is about to begin. However, it is extremely important for every woman to recognize the symptoms of pregnancy. Reasonably, the hope starts as soon as a woman misses her periods. It is important that you identify certain symptoms beforehand to confirm the news. Question number 1: How soon can I see the pregnancy symptoms? Doctors say that in some cases symptoms can be seen as early as 1 day after conceiving. It also depends on how aware you are of your body and the situation. It takes about 6 days for the egg to travel up to the fallopian tubes and get implanted in the uterus, but the body starts sending signals as soon as the egg is fertilized. This phase is a little painful, especially for first-timers, and feeling anxious is perfectly normal, but you should learn ways to stay relaxed. Stay positive and surround yourself with your loved ones who can take care of you. Clear all your doubts with your doctor, family and friends so that you are not under any unnecessary stress. One of the more common symptoms is a missed period after sex. A missed period is not necessarily a sign of pregnancy, but it is possible that you may have conceived. At such times, it is helpful to take a home pregnancy test to confirm the news. Here are the most commonly experienced early symptoms of pregnancy. Number 1. Nausea and digestion problem. Nausea is one of the most common signs of pregnancy. Nausea or morning sickness varies from individual to individual. In some cases, it starts after 2-3 weeks of conception, and in some situations, after a month or 2 of conception. A woman can experience it anytime, be it morning, afternoon, evening or night. For some, nausea continues throughout the pregnancy, while for some, it lasts only for the first few months. There are also a few lucky women who do not face it at all. Nausea and other digestion-related problems like acidity and constipation usually occur because of changes in hormones and the belly structure of the body. To prevent or reduce morning sickness, doctors prescribe medicines that are free from side effects. It is advisable not to consume alcohol or tobacco during this period. Also, avoid going without food for a long period. If you are experiencing morning sickness, it is better to increase your fluid intake, as it will prevent the formation of acid in the stomach. Also, stay away from oily, spicy, heavy and fried food or food with strong aromas. Take small meals and keep snacking in between. Ginger and vitamin B6 supplements may also help reduce morning sickness. Number 2. Tender breasts and sore nipples. Breasts show significant changes even in early pregnancy, like developing varicose veins, enlargement, tenderness and pain. Some women will also find their nipples protruding, and the areolas becoming darker, bigger and spotted. This occurs because of the changes in hormones like estrogen and progesterone. As a result of these changes, the supply of blood to the breast area increases and makes them very sensitive. Sometimes, the breasts become itchy and may also develop stretch marks in the later stages. During the next few months, you may also notice bumps around the areola. As your breast size will increase, it is advisable to go for bigger-sized bras. One should always wear bras that provide good support, like an underwire bra or cotton bras that facilitate the right fit with breathable material. Number 3. Mood swings and irritability. A woman's body undergoes so many hormonal changes in pregnancy that their mood fluctuates frequently. Effects of pregnancy include nausea, physical discomfort, headaches, pain, stress, difficulty in sleeping. To avoid this situation, one should try to get lots of sleep and rest. Eat healthy. Live stress-free. Breathe fresh air. Do light exercises. Stay positive. Number 4. Frequent urination. Due to hormonal changes and increase in blood circulation, the rate of blood flow in kidneys increases, and this causes the filling up of the bladder frequently. The frequency of urination will increase as the pregnancy progresses and the blood flow to the pelvis increases. Also, the baby applies pressure on the urinary bladder, which is another reason for frequent urination during the later stages of pregnancy. In addition to this, the ligaments of a pregnant woman stretch and the uterus expands, because of which less space is left for the bladder. Number 5. Food cravings and food aversions. Many women develop food cravings in pregnancy, while others develop strong food aversions. Sometimes, pregnant women start hating the food which they used to love and do not want to even look at it. This is believed to be due to rapidly changing hormones that also have an impact on your appetite and outlook toward food. Number 6. Fatigue. One of the most common pregnancy signs after missed period is fatigue. If you start getting exhausted or feeling tired all the time, you should take rest and take it easy. The first trimester is very risky, so do not overexert or carry heavy weights. Learn to relax, call for help, and let go of unimportant things in life. In the first 3 months, the development of the placenta consumes a lot of energy, which causes fatigue. Moreover, the blood sugar level decreases. This also contributes to making the body lethargic. However, one should not worry about being tired, because it is completely normal to feel that way all the time in the first trimester. Number 7. Increase in body temperature. You will notice that your body temperature increases, like it does before periods, and you will feel hot all the time. If you notice a rise in body temperature for 2 weeks, then most probably the stock has visited you. Again, it is the hormonal changes in the body that cause the rise in body temperature. The level of progesterone increases considerably, and so does the rate of metabolism. Number 8. Lower back pain. There are many factors that lead to pain in the lower back in early pregnancy. The first reason is increasing weight and the expansion of the uterus. The ligaments of the body loosen up, because of which the torso and posture change considerably, leading to back pain. The torso takes a substantial amount of weight, and this puts a strain on your back. One needs to be very careful with posture during pregnancy, because many women end up harming their backs, which alters their body structure permanently. Take care of things like getting droopy shoulders, round neck or double chin. It is not necessary that all women face this problem, but many women do, which makes it essential to be careful. Number 9. Implantation bleeding. Some women face the issue of slight bleeding and spotting because the fertilized egg starts to implant itself in the uterus. Usually, this sort of bleeding occurs 3 to 6 days after fertilization, once the fertilized egg has been implanted. You will also notice that the color of the vaginal discharge is light pink and not the usual dark red color of menstruation. Some women might face an increase in discharge as well as cramps in the stomach because of the implantation of the egg. However, if the bleeding persists, it is advisable to consult a doctor. Number 10. Bloating. Hormonal changes and nausea cause gastric problems, because of which many women feel bloated all the time. The muscles in the digestive tracts begin to relax in the beginning so that the pelvis stretches and prepares itself for the delivery. The implantation of the egg may also cause swelling in the uterine wall, leading to a bloated feeling. Question number 2. When to take a pregnancy test? If you are wondering when to take a pregnancy test after a missed period, just wait for a week after missing one. You can simply take the test at home. If you are experiencing any or some of the above symptoms, then stop asking yourself when to take the pregnancy test and just take it. For that, all you need to do is to buy a good pregnancy kit and collect a urine sample. Use a dropper, place some urine on the stick and wait for some time to check the results. Many kits ask you to wait for 5 minutes for the results. If it shows a positive result, then your pregnancy is confirmed. It is recommended to wait for at least a week after missing your periods to get confirmed results. HCG, human chorionic gonadotropin, which is a hormone produced by the placenta after implantation, is high in a pregnant woman's urine. It is because of this that you get a positive result. When the test is confirmed, It is time to see a doctor for pre-pregnancy testing and begin the journey to a fulfilling pregnancy. It is our short effort for you. If you like this video, then don't forget to subscribe my channel.